Hi, this is Dr. Cassis. We're going to talk about keratoconus today and answer some of the common questions that come up. So keratoconus, what happens is that the cornea, which is the outer layer of the eye, has this disease where it progressively goes forward, thins out like a cone. So I just wanted to show you sort of an example for this patient. This eye is the eye with the keratoconus, and this eye is the normal cornea. So where the color is hot, obviously it's like a topography, it works like a topography map. So where the color is hot, it's going to be really elevated. And then this eye here has it a little bit, but definitely not as significant. So that causes problems on many levels. First of all, vision, right? So if the pupil is centered here and then looking through this cone is going to cause us a lot of aberration and a lot of distortion and a lot of blurred vision. So for many years what we've done is use gas perm lenses, like the small hard lenses that we would put on top of the cone, and the thought was to sort of recreate a new optical surface and bring better vision. The disadvantage of the gas perm is mainly comfort, because it is a smaller lens, so every time you blink you feel that lens until you sort of develop a lack of sensitivity or lack of awareness of the lens being in the eye. So what we've used more recently is what's called a scleral lens, and that's probably at this point the best option to correct keratoconus. So a scleral lens it's also a hard lens, but it's a much bigger lens, and it sort of lands on the white part of the eye, so there's no awareness of the lens being on. It's extremely comfortable and then gives the patient great vision, because once again it recreates a new optical surface and get rid of a lot of distortion and a lot of the blurred vision. So like you saw in this patient here, the keratoconus is much more obvious in the right eye than the left eye, but most of the time it is a bilateral disease, meaning people have keratoconus in both eyes. One eye is usually more severely affected than the other. In my career, I'd say that it's probably half and half, the people that only have it where it's very troublesome in one eye, with the people that have it where it's troublesome in both eyes. The other question that comes up is, if I have it, will my kids have it? So the risk factors for keratoconus is there's many different factors that promote or create the keratoconus. Genetic is one of them. Often those patients have a lot of allergies and are eye rubbers, and so the thought is, as you rub your eyes a lot, you create or change the shape of the cornea, and those patients often have severe allergies. And sometimes it just happens, we're not sure why, and the patient will be affected with keratoconus. It does most of the time progress over time, and the thought with the contact lens is to give great vision and good comfort. In some patients, it gets to the point where the cornea is so thinned out that it's no longer functional, and those patients have to have a corneal transplant. And now there's new treatment to prevent that from happening, and the scleral lens are one of them. There's also cross-linking. There's new things, new technology that prevent the transplant from being necessary. So those are the main facts about keratoconus. If you have any other questions, please call the office 596-4018. Thank you.